Good morning and good afternoon, everybody. Thank you for joining us. We're just going to give a minute as everybody piles into the webinar here, and we will get going momentarily once we're at critical mass. Well, we might as well get going. Thank you, everybody, for joining us today. We are going to be giving a bit of a debrief on the federal budget and specifically focusing in on healthcare, talk about the bilateral deals, talk about some other funding initiatives, and then what else is going on in healthcare in the federal scene. For those of you who have not interacted with us before and are joining us for the first time, Santis Health is a health and life sciences consultancy. We do a lot of work in the healthcare sector across Canada with offices in Vancouver, Toronto, and Ottawa. We focus in on strategy and policy development, communications and stakeholder engagement, as well as government relations and advocacy. And joining us today is a stellar group of awesome people that I get to work with every day. So myself, I'm Peter Cleary. I'm a principal here at Santis Health. I've been here for a number of years and have a history of working with federal and provincial governments over the course of 3 or 4 different premiers and prime ministers. And my awesome colleagues who will be speaking today, Danielle, based out of Ottawa with us, has worked for a number of health charities as well as Research Canada. James Mitchell, who's worked for the Leader of the Opposition and is based out of Vancouver and has extensive experience working in conservative politics. And then Marcel, who has spent a considerable amount of time working for the federal government. He was my colleague as for a short period when he was assistant. Well, I was there for a short period and Marcel was there much longer as when he was assistant associate deputy minister of the strategic policy branch at Health Canada. And we're pleased that everybody is able to join us today. So with that, we will give you a bit of a high level. Here's what's happening politically at the federal level. We'll do an overview of the budget, and then we'll keep getting into more detail as this presentation goes, because we want to give you a good sense of where we see these agreements with provinces and territories, where they're going, as well as some of the other things that are happening that we may have information on and we may not have information on, but we will share what we have with you and then launch to some key takeaways and answer some questions. A little bit of housekeeping before we get going. There is a Q&A function button, which is quite awesome in this webinar, Zoom webinar interface. You can ask questions in there. We will answer them in writing and verbally. We will try and get to all of them. And if we can't, we will follow up with you after the webinar where possible. We will be sharing the slides and the recording of this webinar, so you will get an email after the webinar. It will automatically go to you, so do not fear. It will be there for you, and you are able to share it broadly and widely with your community as you see fit. And we will also do a survey, which we implore you to fill out because it helps us figure out what sort of content to do in these webinars going forward. And we do hold these not just federally, but we've done them for our different practice areas at Santis to try and give you an added value take on how we see the health world. So with that, I believe I am turning it over to my colleague, Danielle.
Thanks, Peter. So as everyone should be familiar with by now, the Liberals continue to hold a minority government bolstered by the Supply and Confidence Agreement with the NDP. And if this agreement is seen to its completion, the Liberals could hold power until June of 2025. So the Liberals right now are walking a political tightrope between fiscal restraint due to criticism from the Conservatives on spending and affordability for Canadians, pressure from inflation and the economic downturn, while having to maintain commitments under this agreement with the NDP. So if they're going to have to convince Canadians that they're doing enough to address the economic downturn while balancing these competing priorities. So it's clear that the governing Liberals are hoping to appease the political spectrum to protect the vote-rich middle ground, with a health spending deal akin to Martin Liberals and supported by the Polyev Conservatives, billions more in the social safety net to satisfy the NDP, and affordability measures on groceries and alcohol. The recent budget has something for everyone, so whether it is enough to satisfy Canadians remains to be seen. But at this stage in the government's life, keeping caucus happy is the most important thing the leader of a party can do. So constant engagement, attending caucus meetings, and ensuring the budget reflects what they are hearing in their ridings is incredibly important. So the grocery rebate likely speaks to this need. Now, at the grassroots stage, a leader needs to shore up support from party membership. So the LPC convention is the first weekend in May, and this gives the Prime Minister the opportunity to test his stump speech and motivate his base. And on the organizational front, it is a minority government. And regardless of the deal with the NDP, they need to be prepared in case the government does fall. So to this end, the LPC have been getting their existing MPs approved as candidates, and candidate recruitment will be an ongoing focus along with fundraising so that they can govern with confidence. A powerful government is one that isn't afraid to lose a vote and go to the polls. So being well prepared and equipped as a party better enables the government to manage a minority parliament. So over to the Conservatives, Pierre Poilievre has been leader of the party for a while now, and unsurprisingly, they are focusing their message that Canadians need a government who will show fiscal restraint, which has been amplified from the recent spending in the budget. Now, something of note is that they have agreed to keep the health agreements in place if they were to take power, so this should be a comfort to most Canadians. Also, the Conservatives continue to fundraise really well, far outpacing all other parties. And the CPC convention is in Quebec City this fall, and so far they have yet to formally nominate any new candidates. Also, as of right now, Poilievre seems to have the support of his caucus and party. And the NDP is currently in a pretty good place politically because they are wielding some power through their agreement with the Liberals, and they will certainly be emphasizing their influence in the budget, in particular with the dental care program, to their supporters in the next election. In terms of finances, the NDP does not have a lot of money, so that is something to consider with any election predictions. And their convention is set to take place in Hamilton in October. So healthcare is obviously on the minds of Canadians, both federally and provincially, and a recent poll has shown that Canadians have rated the federal government as very poor in healthcare delivery, with a pretty significant change in dissatisfaction by 21 points from 2021. Canadians have not rated the province's handling of healthcare much better, with an increase of dissatisfaction by 15 points since 2021. So this poll shows that Canadians are aware of the systemic issues that the healthcare system is facing, as it has been challenged by things like COVID and HHR issues. The number of issues are bigger than the number of solutions. So each province is trying to tackle this in their own jurisdictions. The provinces and territories are making those decisions based on their own needs. So we will continue to watch as these action plans unfold. Now, given the dissatisfaction of Canadians on healthcare and the recent new money infusion, there will be a lot of focus on these bilateral agreements and what they're going to mean for the struggling healthcare system. So there is pressure both federally and provincially for Canadians to start seeing improvements. And this will likely continue to be a big priority in the next election as well. Now, interesting to note as well that the federal government does not actually deliver healthcare, and that is left primarily to the provinces and territories, yet Canadians still expect the federal government to be responsible for healthcare. So this will constantly be a challenge for them in terms of optics for Canadians. This is another reason that the implementation of these bilateral agreements needs to be a positive story that the federal government can use to show Canadians that they're ensuring the improvement of the healthcare system and that they're part of the solution. So Peter, I don't know if you have anything else to add to that. If not, I'll pass it over to James.
No, send it right to James.
Thank you, Danielle. So polling has been fairly consistent since 2019, since Justin Trudeau entered into his re-election campaign in that year. We've seen a largely consistent trend where the Conservatives are ahead in between elections, there's ups and downs, but that's largely what happens in between. And then once the election starts, things narrow up. The Conservatives have an extremely committed and stable and durable voter base. The challenge with that is that it's very concentrated in rural parts of the country, particularly the prairies, where they run up huge majorities, 70–80% in some seats, but it's not very efficiently concentrated. The Liberals, on the other hand, have a very efficiently concentrated voter coalition based in urban parts of the country, based in the suburban areas. That's where most of the seats are. That's where they're able to form a government. And notably going forward, that's where the population growth in the country largely is. It's in those suburban areas, Toronto, Vancouver, Montreal. That's where, the future growth for seats is. In recent weeks, the Conservatives have opened up a bit of a lead. There's lots of factors that play into that. Inflationary pressures that we're seeing, some of these stories about China, election interference in the last election, all of these things seem to be feeding into a little bit of a surge for the Conservatives. But we've seen this in the past. The last two Conservative leaders had sizable vote support going into the last couple of weeks of the election. And then it kind of fell apart towards the end. The Liberals were able to recover. Even though the Conservatives won the popular vote, they've lost the seat count. Going into the next election, whenever that is, I think that there's different factors, there's different fundamentals that will come into play. The economy is relatively strong. The job numbers are relatively good. Prime Minister Trudeau is still relatively popular, has the support of his party. Those are things that are in his favor. And just historically, the average Liberal government since Confederation has been 12 years. He's only at 8 through his, so there's encouraging signs on that end. For the Conservatives, there is a lot of concern about inflation. This is a government going for a 4th term. There is lots of opportunity there for it to be a change election. On the other hand, Poilievre is already facing challenges with support for women voters. We're not seeing that there. There's a significant gender gap. It's also unclear whether some of these issues that have challenged the Conservatives in the past during elections, firearms, vaccines, environment, healthcare, social issues, will be something that Poilievre is able to overcome and convince centrist voters that he is acceptable in those issues to them. That remains unclear. So I think the bottom line is that at this point, as is always, it's really kind of tough to say, oh, one party's going to win for sure, the other party's going to lose for sure. We're just not able to predict that at this point.
Thanks, James. I think this is over to me at this point in time. So let's talk about the budget at a glance, and then we'll start getting into a little bit more detail. It's funny, as a health consultant, we walked into this and we said, oh, there's nothing surprising in here, so therefore it's not a health budget. When in reality, it's a very significant health spend in this budget, and likely, well, it probably outside of COVID one-time funding, it's the biggest health budget we would have seen out of this government since they were elected in 2015. Just to remind folks, the 2016-17 healthcare accords was $11 billion over 10 years. And that at the time was seen as a massive, massive investment directly into home and community care and mental health and addictions. And this budget, we're seeing a significant amount in bilateral agreements, one-time top-ups for the Canada Health transfer, and the rest. In total, a net new spend of $49 billion over 10 years, over and above the existing spend that has gone in through pandemic spending and the previous healthcare accords. Dental care has cost a significant amount more than what they had budgeted. It'll now cost $13 billion over 5 years. All of this is to say there is a ton of investment in healthcare in this budget. And I think it's a little bit there's a little bit of ambiguity in terms of what does that mean for practically, where is it going to go, what the investments are going to be, how to access it, and what the metrics of success will be. There's a lot of really good questions that we'll tease through in this webinar with Marcel. I think there are some fair questions that we have and that we've heard from others as well too about what's missing from the budget. There's a lot of numbers in terms of big investments, but seemingly no mention of the commitment to create a dedicated mental health transfer, light on any new information around pharmacare and the Canada Drug Agency. Palliative care wasn't mentioned. Long-term care is included in the bilateral deal and the agreement with provinces, but it wasn't specifically called out, especially because they had done a lot of work on standards. Health research is seemingly absent. So it's likely that some of these things will be addressed in bilateral deals, but oftentimes when you see a budget, the first thing you do is Control F and find those, key statements to see what's a priority and what's not. So notable to say that they were not necessarily mentioned in the budget, but also notable to say that there's opportunity for them to be addressed, considering the investments that the government's that the government's putting in place. Across the board, and I went back and I looked at some of our webinars from previous budgets in terms of the specific health funding. And there's been a couple of years where we would give you a little bit in terms of here's a little bit of what they did, a little bit of health research here and there, but predominantly there were other priorities in the budget. And in this one, it's a little bit different. There's specific funding for the National Suicide Prevention Line, which is a Conservative private members bill that is finally coming to reality, and I think coming to reality with a lot of fanfare as well too. Significant dollars for Indigenous health and health equity through that health equity fund, and there's some additional funding in not the bilaterals, but the health offer to provinces and territories. A territorial health investment fund was included in the offer to premiers a couple months ago, expanding access to family health services, a lot of work on data. We'll talk about that a little bit more. Investments to renewing Canada's drug strategy. Significant work has gone into HHR, and so there's some dollars set aside there. Again, we'll touch on that. We'll talk about the Canada Health Transfer, as well as improving access to quality mental health services and substance use services. So it was a meaty budget in terms of funding. I think if I did level a criticism, and this is more the key takeaways that I'm probably jumping ahead to, but it's not necessarily a health policy budget. There's a lot of questions that need to be answered. There's a lot of work that now needs to start. So I would describe this budget as one that's a down payment to start a whole bunch of work on these policy files, and it will be a testament to how well provinces, territories, and the federal government are able to work together with stakeholders to make any headway on any one or a number of these priorities. So we will get into that in a moment, but I think first, James, you're going to give us is this thing going to pass? Are we going to an election? The question that all the people on this webinar probably want to hear the answer to.
Yeah, so the Conservatives, the official opposition, have come out and said they will vote against this. It was kind of a given beforehand that was likely going to be the case. So that's where they've stood. The Bloc and the Greens have also come out and indicated that they will not be supporting it. The NDP, on the other hand, they have a confident supply agreement with the Liberals. One element of that was dental care. That's included in the budget. Jagmeet Singh has said that he is supportive of that. And so in all likelihood, Liberal and NDP votes together will pass this thing. We will not have an election. The Liberals only need the NDP for this budget to pass. So it won't, if there's an election call, it won't necessarily be a confidence vote on this. I think that there's two kind of interesting things to note on all this. One is how stable a parliament this is compared to the minority governments we've seen in the past. Prime Minister Trudeau effectively has a majority government with the NDP support right now through this confidence and supply agreement. The two parties, by and large, seem to be working closely together, and that has produced this stability. I also think in the way this is rolled out, the messaging from the government and the opposition reaction, you're seeing a lot about what the next election might look like or what the priorities for these parties are. The Conservatives are going to want the next election to be the ballot question. When people go to vote, they're going to want it to be on the economy. Their response to this is criticizing based on inflation, criticizing based on housing, lack of housing availability, and taxes like the carbon tax. They are going to want those issues to be front and center when voters go to vote. The Bloc wants to continue to be the champion of Quebec. That's the role they want to play. In their response, they're criticizing the rate of health transfers to Quebec, very consistent. The Greens want to maintain the fact that they are a voice for the left, for the very environmentally progressive. Their criticism based on things like lack of CERB amnesty, various livability issues, things like that. The NDP is going to try to demonstrate that the value proposition for that party is you vote for us, we can get things done in a minority parliament. We can be the voice for the issues that you care about. If you are a progressive voter, you're not wasting your vote by voting NDP. There's a valuable return on investment through things like what they've been able to achieve through the dental care in this budget, which they are claiming is very much an NDP budget in that sense. And so I think that's where they're going to go. The Liberals are going to show or are looking to show through the messaging on this, through what they've done here, that they're the party that's the natural governing party of Canada, as they used to say. They can be trusted to deliver healthcare for Canadians. They can be trusted to take care of the needs of Canadians when there's a pandemic or other emergency, and they're the best option that people should be looking at the next election. So, like I said, the way this is rolled out, the responses, I think, just really help forecast broadly where things are going to be directed in the next election, or where people are going to be hoping they're going to be directed through these parties.
Thanks for that, James. So I think, Marcel, we're going to turn over to Marcel to start walking us through the federal, provincial, territorial deal. He's been through a few of these, so I guess past behavior is a good predictor of future behavior. So Marcel, make some sense of this for us.
Yeah, thank you. And hi, everyone. So I think what we saw in the budget was, very expected and important was the confirmation that the money that was promised to provinces and territories in the February 7th offer on funding was confirmed. The bulk of the money is flowing to provinces and territories, 46 out of the 49 in incremental new funding over 10 years. And that's really significant. I mean, there isn't a whole lot that's being withheld at the federal sort of national level to fund national projects. I'll come to some of that on the next slide. But the bulk of the money, the provinces and territories, and the figures you see on this slide are really sort of a subset of the overall increase of north of 198 billion over 10 years in increased transfers and increased investments in healthcare. So those are pretty significant figures in any calculation. So the premiers didn't spend a lot of time mulling this offer over. A week after February 7th, they agreed as a collective that they would accept the federal offer. And what we've seen over the last few weeks is individually at a political level, all of the provinces except for Quebec have signaled their agreement in principle to accept the federal offer and to proceed to bilateral agreements. And so on the bilateral agreements, this is a pot of money, 25 billion over 10 years. And the four priorities that have been agreed to are family health services, which is primary health care reform related for the most part. Secondly, health worker support, health human resources, and whittling down those challenging backlogs in procedures across the country. Third, mental health and substance use, which has been a constant as a federal priority now over the last number of years, at least under this government. And then lastly, modern health system, which is captures both the health data modernization piece as well as the health information systems, electronic health records. So those are the four priorities around which the bilateral agreements are going to be structured. Now, outside of those agreements, there are different pots of money that are really going to play an important role in the rollout of the agreement. Firstly, in terms of the Canada Health Transfer, you have a top-up of the CHT and this guarantee of a 5% escalator. And so that's new. The provinces had been asking for a 5% escalator. They were also asking for $28 billion per year more in CHT, which they didn't quite get, but they got the 5% escalator, and that's really important because that means that the CHT will not increase by anything less than 5% going forward. It could increase by more if GDP growth is higher than 5%. So that's a really interesting development. And as mentioned here, for the first 5 years, the provinces will only get access to that top up of 5% if they are playing ball with the federal government on this health data sharing arrangement. So that's also an interesting twist to the conditionality discussion that has been ongoing around how the federal dollars are attached to conditions that the provinces have to respect. There's also money in the budget, in the health agreement for CIHI, Canada Health Infoway, and other health data partners at the federal level to move ahead with a pan-Canadian data strategy that includes collecting and reporting health data in a timely way, and developing and tracking indicators of performance in the priority areas. And there are a number of headline indicators that were baked into the health agreement. There's also a few other pots of money, 1.7 billion over 5 years for PSW wage support. There is the Territorial Health Investment Fund, as was mentioned earlier, $3 billion for long-term care. That was a budget 2021 commitment that had not yet been negotiated with the provinces and territories. So that now is being rolled into these agreements. And there's also the Health Equity Fund for Indigenous populations at $2 billion. And the last point here is just to remind everyone the deals that were signed back in 2017 on home care and mental health. The first tranche of bilateral agreements for that set of deals had expired earlier this year. And so with this new arrangement, provinces have committed to renew those agreements as well for the balance of the 10-year commitment.
I might just add, Marcel alluded to it quite nicely, but this is a list of priorities that the federal government has either directly committed to or alluded to over the past number of mandate letters, the Liberal election platforms, and they were able to jam quite a bit in here to meet some of their previous commitments. There are some that were not included here, and we'll talk about those in a couple of minutes. There's some glaring absences, but all things considered, they were able to make some pretty big movement. And I would highlight the wage increase and funding for long-term care, that they had money set aside, they were commitments, but they couldn't get any movement on them for the last number of years. So the federal government would be very, very happy with how much they actually got into this to meet some of their previous commitments in previous budgets and election platforms.
Mm-hmm. Those are great points. Thanks, Peter. So back to the bilateral agreements then. Basically what's going to happen now is, there's some broad structural pieces here. In order for the provinces to access their share of federal funding, I mentioned earlier, to the guaranteed 5% growth in CHT, they need to do a couple of really important things. Firstly, they need to be part of this pan-Canadian data strategy that is only sort of beginning to sort of emerge. We've seen some work on this by the expert advisory group over the last couple of years during the pandemic that developed a fairly elaborate game plan to ensure Canada ups its game in terms of common data standards and policies and governance. And so we're going to see a lot of movement there, led by CIHI and Infoway, and presumably involving all the provinces and territories. And secondly, they had to sign off, the provinces did, on the bilateral agreement structure that had been proposed, and that includes agreement to the shared priorities, to the results, to these headline indicators that have been included in the agreement. They also will be required, the provinces will be required to produce action plans that will describe how the money that they'll receive through the bilaterals is going to be spent. And that money has to be incremental, not just shifting money around. It's got to be incremental to what they had planned to spend. How they're going to measure progress, how they're going to report that to their residents. And then another interesting piece here, which I think is testimony to lots of hard work by organizations across the country to make sure that there's a greater labor mobility across the country for health workers. So that accelerated credential recognition, I think, is a big win for many groups out there. And just to mention too, that in the action plans and the bilateral agreements, that jurisdictions will have considerable flexibility in terms of how they design their plans, how they will measure progress and report to Canadians beyond those indicators that are agreed to at the level of the broad agreement. And I think, in comparison, I think in some ways this set of bilaterals may be even more flexible than the prior set. The prior set, you had targeted amounts of money for home care, targeted amounts of money for mental health. And so the jurisdictions had to spend in both areas. They had to say what they were going to do in both areas. In this next round, what we're going to see is that there's flexibility across those 4 priority areas. Jurisdiction may choose to invest in 1, 2, 3, or 4 of those areas, but it's really up to them how they want to use the funding, as long as they respect the other broad parameters that has been laid out in the agreement.
That's a nice way, Marcel, to answer a question we have in the Q&A around what does family health services include. I don't think that there's a very definitive definition of what each one includes, and that's likely quite purposeful to give provinces and territories the flexibility to decide what they want to invest in at a particular time over the course of the next 10 years. And that's essentially what it's doing. That some provinces in the Atlantic might feel like doctor shortages are a greater issue than another health issue, maybe surgical backlogs. I'm making it up. I'm not saying that it's not, but it gives the ability for that jurisdiction to say in the next 3 years, these are our top priorities, and this is where we're going to be driving resources for. And then in subsequent plans, those priorities might change based on the success on the first, or based on the needs of that particular time.
Mm-hmm. Yeah, that's a great point. I think perhaps, again, even more so than the last set of agreements, there's more flexibility on the definition of these things. Family health services really wasn't, you could think that primary healthcare reform is broad enough. Family health services, takes that even more broadly potentially. So lots of room to maneuver there for all the jurisdictions. And maybe just before moving on to the end of the presentation, just a quick sense of where these bilateral agreements are going. Maybe we can move to the next slide. So there's a few things that need to happen before you start seeing formal bilateral agreements being signed and announced across the country. What we've seen to date is just political level agreement by, premiers, ministers of health, federally, provincially, signaling that, they're going to play ball here. For the bilateral agreements to actually be, developed and signed, the budget has to go through because the money is proposed, but Parliament has not yet given its approval for those monies to be spent. So that has to happen. For those of you who are familiar with how things work inside the federal government, Health Canada has to get the approval, the terms of condition and the conditions from the Treasury Board before it can go out and sign any of these agreements. And that typically, this is what happens, after a budget announcement, it takes another 2-3 months, typically before the end of June, before those sorts of approvals are in place. Now, that doesn't mean the feds can't be out there talking to the provinces. They just can't sign any agreements yet. So I would expect that discussions are happening between the federal government, Health Canada, and the relevant ministries of health across the country. And as part of those discussions, I would assume that provinces are starting to develop those action plans. They've probably been given, you know, the templates and the rough guidance from Health Canada around what they expect to see in these action plans. There are probably discussions happening at the provincial level within the ministries around, you know, what do we want to run with here? How are you going to use these investments to mesh with our own plans to further invest in healthcare? Where are we going to put the emphasis? How do we measure progress? So that creates an interesting opportunity, I think, for folks that, you know, have the associations provincially, nationally, your federated models, to try and get your messages across to provincial decision makers around what you would like to see in these bilateral agreements. And there will also be some further steps at the provincial level. Once there is an action plan that's been developed and, you know, a funding agreement that's been negotiated with the government, there needs to be approvals at the provincial level too. Provincial ministries may have to take, you know, the whole agreement to their treasury board before it gets finalized. So lots of things have to happen, and that can take months before we are likely to see the first set of agreements actually announced. So I would expect maybe in the fall at the earliest, you could see some of these agreements formally announced, but that could carry over into the next fiscal, or at least the end of this year, and possibly into the next year, before we get all of the 13 bilateral agreements signed, sealed, and delivered. And
Maybe,
yeah, go ahead.
Go ahead, Marcel. No, you go.
I was going to say the last thing is that this initial round of bilateral agreements is going to last for the first 3 years, 2023, 24 to 25, 26. And then there's going to be another couple of rounds of bilateral agreements that will have to be negotiated as this set expires. A new one will take over, and then a third tranche will cover the balance of the 10 years.
We might be able to proactively answer some questions that are probably noodling through people's heads right now. Just because the bilateral deals aren't in place doesn't mean the funding won't flow. Budgets have been baked in at the provincial level as well as the federal level. The process that Marcel just walked through federally will also exist provincially. They all have their own budgets. They're baking these numbers into it. They will have to go to Treasury Board and do their own policy work to determine where they might want to actually put this forward. They will need to get that approved at Cabinet before they can sign an agreement with the federal government. And they will need to have their own subsequent Treasury Board submissions as they go through individual initiatives as well too. So to Marcel's point, there's lots of opportunity to work your way through with your provincial governments, areas of need and areas that need to be focused on earlier versus later. And a lot of that will be driven provincially. And then to a question that Jennifer asked at the same time, the action plans are set to run for 3-year periods. So over the course of the 10 years, there would be 3 rounds of action plans developed, reported out publicly, with indicators that the governments across the country have flexibility in determining what they believe they should be for the best needs of their provinces and territories. All of this is to say, while this process, which could take quite some time, works its way out, and this is what happened in the 2016-17 Accords, the funding will still flow. So provinces will still get their funding this fiscal year based on what was in the budget and what the details of each annual funding allotment is over the next 10 years.
Mm-hmm. Maybe if I could just quickly answer, there's one question about the 2 billion and the 5% increase in transfer.
Mm-hmm.
So that money is allocated on a predetermined formula. It's equal per capita funding for the provinces. So Ontario's share will be, you know, their whatever share of the population Ontario is, 40% or 38% of the Canadian population. They will get that 38% of the 2 billion and the 38% of the 5% top up on a continuing basis. And those numbers are adjusted every year as Stats Canada publishes new figures on the population and the balance and distribution across the country.
I mean, Peter, just a thought
for
here. In terms of, we've had 4 of the Western provinces have had budgets so far this year. Santis has done recaps of all those. If people want to go on to our website and look at those, but I think that the priorities put into those by each province should give a pretty good forecast of what they're looking to spend money on for the next couple of years. You know, Manitoba had a focus on diabetes supplies, Saskatchewan on infrastructure. Alberta's really focused on improving timelines in the system, both in like surgery wait times, emergency room wait times, response paramedics, looking to bring healthcare professionals. You know, Alberta is calling. BC had a focus on cancer, on providing contraception. So I think that while those are specific provincial budgets and those are specifically for this year, I think it provides people with a good forecast and a good, sense on where at least those 4 provinces, and there's just had budgets in several other provinces across the country, but those should give an indication of where things are going. And like I said, we've done recaps of all those if anyone wants to check those out.
I think that was an excellent interjection, James. And I also think it's important mentioning, and we have it in the details of the action plan development here, that part of these action plans will need to describe how this additional funding is incremental to the existing spending. The big objective that the federal government had in 2015 when they launched into their new approach for healthcare spending was to get away from just giving cash to provinces that could be used for things they were already going to spend money on. The accusation that the feds would like to say is that they don't want it going to roads and bridges when it's supposed to go to healthcare. Whether or not that actually happened is probably, it sounds like it was more posturing around the negotiations. But the intent is to try and make sure that any new funding goes to new initiatives so that you have the base of what is already happening and what can be done over and above what we are already doing to have a positive impact for the populations that each government represents. Anything else further, Danielle, James, and Marcel, before we move on to other stuff? There are a couple questions here that we could probably tackle since we're on this topic. And I'll run through them all and we'll address them as a group. Questions around rural and remote northern issues, prioritize Indigenous health being a priority. Is that part of the flexibility about what provinces need to have in their strategies, or any other mention of equity seeking groups? Sarah, there is specific funding built out for the territorial health fund. There is specific funding that will go to Indigenous communities. I suspect that a lot of that will be distinct and separate from provincial action plans because they are separate budget lines. But that does not mean that provinces won't have their own strategies for equity seeking groups as well too. I don't know if others on the team want to mention or comment on that.
Maybe just one point, when I was part of these discussions a few years ago, we would be going to provincial bureaucrats and saying, asking them to identify in their action plans, is there anything that you can put in your action plan that would address the needs of official language minority communities or racialized communities or LGBTQ access to health services? So they would get prompted to identify any particular investments they want to highlight in the context of the action plan. But it wouldn't be an absolute requirement that they needed to have these things in there, or else they didn't get the money. So that's a bit of a balance there. There are some things that are absolutes, and there are other things that are objectives and nice to haves, and that will be very much encouraged in the context of discussion, but we'll have to see at the end of the day what makes into these agreements.
I would just note in the BC context, the province has consistently indicated a priority for supporting, remote, rural, Indigenous communities, making sure that there's equity across the province as an initiative. In Manitoba, you've seen a similar thing, and I know it's the case in other provinces as well. But there is definitely a focus at the provincial level in Western Canada on the importance of these issues and making sure there's equity in these things.
Thanks, all. On the question of how they might plan to flow the funding for PSWs, it's a great complex question, and it's a tough one for the answer to be found, because I think whatever solution the government comes up with, it's not going to make people happy, because I will use Ontario as a case study. So when I worked in the Ontario government, that's when PSW wages were even lower than they were now, and Minister Deb Matthews at the time raised or committed to raise PSW wages to $16 an hour. And the government had a very difficult time in an accountable way getting that directly to workers. And I would suspect that most unions and advocates would want to see the money go directly to workers, not through employers and otherwise, because there's a lack of trust, obviously, for some employees. This is the problem the government has, is that you're being between two groups. And I suspect there are lots of people on this call that represent all sides of the equation on this. How Ontario handled it at that time was they gave a top up directly to employers to carry through to their employees, and that's how it was delivered. It gets a little bit more complex, because what is likely to happen here is that the federal government would flow funding to provinces, and then provinces will need to come up with their own plan on how they might want to flow that funding. So there is that case study of what happened in Ontario. And if my memory serves me correct, that was probably around 2013. You can look it up and find information on that there. But it would be up to a province to determine how they would want to get that wage bump or support for PSWs to PSWs, either through employers or direct to them. I don't know if anybody on the team wants to amend or provide further. A question around provinces using the money for private healthcare initiatives. Will the feds be able to block it? So great question, because in conjunction with the federal provincial deal, there was some statements sent out by Minister Duclos and the Prime Minister that the federal government will uphold the Canada Health Act and that any funding needs to continue to uphold the Canada Health Act. I suspect the question is probably alluding to, our independent health facilities, private healthcare, and I don't think they are. In fact, the private sector has been heavily engaged in the healthcare system across Canada since the healthcare system was anything robust in the way that it is now. And as long as it's publicly funded, the single payer is the government, and the government's coordinating that care, and the patient, the individual, the Canadian, is not paying out of their pocket, then it's complying with the Canada Health Act. Health Canada has and will take action if it has gone outside of it. So if people are paying user fees, if people are paying to access MRI clinics in advance of others, that is something that the federal government has taken action on and clawed funding back in several circumstances: Quebec, British Columbia, Manitoba. And I think you'll see the federal government be pretty active on that. And I believe they did do some funding clawback recently, actually, since the announcement and the federal offer. Question around any suggestions on how to track the implementation action plans at the provincial level. So maybe I'll open that up to the group. Marcel, you might have a comment here.
Yeah, I mean, this is a really good question. I think what we found in the last round is that, okay, it's one thing to have these agreements posted publicly and the action plans posted publicly at the beginning of the process. But really, there's very little visibility publicly and from stakeholders into A, the development of the agreements, or B, their actual implementation over time. So it'll be interesting to see whether in this next round, there is a little, opening, a bit of more opening in terms of visibility into that process, maybe more frequent reporting nationally, or, joint reporting by the feds and the provinces around what is actually being accomplished by these agreements. There is the High reporting on indicators that they started that on mental health and home care indicators every year, reporting out on what all these investments add up to in terms of moving the needle on these high level indicators. But that, that takes time. It takes time to develop the indicators, and it takes time to move the indicators as well. And so you're not really getting a really good sense of, what concretely is changing on the ground. So really interesting to see how that process unfolds in this next round. But I would say, get to know the people at the provincial level who are engaging in these discussions. If you have a way in, and try and ask questions of the ministers, the people in the folks in the senior decision-making positions, ask questions from Health Canada as well. They have the capacity to do periodic reporting out, and the more pressure they feel for visibility and accountability on these agreements, the more that there will be.
We'll do one more question, then we'll run through the other health policy files. David Clements, who some of us on this call know, he asked a very good question, and I know he has a very good answer, and I want to hear his answer because it's probably better than what Marcel and I can come up with. But he asks, are there elements of the bilaterals which could reasonably expect to slow the future rate of growth in healthcare spending? Which is a truly fantastic question, because that actually gets to the question that was asked previously around how do you track the spending? And if all of a sudden the federal government's contribution is 5% year over year increased to the CHT, and provincial spending is only 1 or 2%, you can probably do some rough math and figure out whether or not the rate of growth is aligning with the rate of growth from the federal government. But I think, Dave, you probably know this just as well. I would imagine the question is going to be more around how steep is a recession in any particular province, what deficit reduction measures need to take place. Provincial balance sheets are actually pretty good, but at least in my experience working provincially, the only time we saw a decrease in the rate of growth for healthcare is when we had to do deficit reduction spending. As long as you're in a relative surplus position and the funding continues to come from the federal government as an incremental growth, that spending usually sustains itself. There are others on my team, Dan Carpin and others, who probably have a better answer than this, but I don't know, Marcel, if you have thoughts here as well.
Yeah, I think that's bang on, Peter, and hi, Dave. I think that there is very little actually in this agreement that speaks to any notion of greater efficiency or appropriateness in care, or any sense of rationing, even in the most delicate and indirect way. I think it speaks to the pickle that we find ourselves in, which is the health system is in crisis, and no one wants to talk about reducing spending at this point. It's really about shoring it up and making sure that it's sustainable from a access and universality perspective going forward.
Okay, we have 8 or so minutes left. And with that, we'll try and give a quick update on what are the other health things going on that you need to pay attention to. This was a fantastic, robust discussion on the bilaterals. On long-term care, there is funding in the bilateral agreements for long-term care, the $3 billion. So there will have to be action plans, and there will have to be spending plans related to that long-term care investment. But there are national standards that have now been released, and they're not being enforced. I think that's the takeaway. The federal government would like them to be used, but provinces and territories are under no obligation that they must actually use them. On national strategy, for drugs for rare diseases, this was a big announcement a couple of weeks ago. We alluded to this earlier in the presentation. This would be a net new bilateral deal that provinces would need to sign on to. And as of yet, and I'll look to my team and we'll check the responses, I don't think any provinces has put their hand up and said, we're ready to negotiate a bilateral on rare drugs. So the federal government has $500 million a year, I think, baked into the fiscal plan this year, next year, and the year after, $1.5 billion total. There is a little bit of money for the PANCANs in there as well, too, which can start doing some work now on patient registries and some supportive policy work that the federal government can provide. But there is I think there's probably a little bit of the federal government's approach, actually. This has been a commitment since 2019. And by announcing it, saying the money's there and putting the pressure on the provinces, it now puts it in the provincial government's court to come to the table and say, we're ready to accept money. The criticism that you'll likely hear from provinces is that it's such a short period of time. It makes it challenging for a province to start funding initiatives when they see a short period of time that the funding is active for. They can't undertake permanent, effective programs when they only have a 3-year window. They can fund a bunch of really good, awesome projects, no doubt, that will have a very positive impact. But when you want to look at the measurable difference over a long period of time, the provinces would likely say, We need permanent, ongoing funding, not a short period of time. So that's the tit for tat that's happening behind the scenes, I suspect. Pharmacare is quiet. Canada Drug Agency are quiet. The federal government took approach in this last budget that they needed to have funding in place for the things that needed to be done based on the deal with the NDP. That was dental care. Dental care got the money, and dental care got a lot more money than the federal government likely wanted to commit to. The federal government still needs to put in place a piece of legislation, at least table it by the end of this year, on pharmacare. I don't think they have authorities to go out and do a formal consultation as of yet. I know Health Canada is happy to hear ideas. If somebody has some brilliant silver bullet idea for pharmacare, I'm sure they're all ears. But at one point in time, we will see a legislative proposal from the federal government in order to maintain the agreement that they have with the NDP, and the NDP are fully expecting it. I don't think you're going to see something that will come out by the end of the year calling for single payer or anything like that. I think it will largely maintain the existing system, but it needs to be, how do you create resources to allow more people to get coverage that perhaps don't have great coverage or they have no coverage. And there's a lot of great examples that we've talked about in this presentation today around bilateral deals that could probably achieve that. And I suspect that's where the federal government's brains would go. And that's exactly what they did for childcare, actually. They got bilaterals in place, and then they enshrined those in legislation to make it hard for any government to reverse them based on a stroke of a pen in the budget. They'd have to take a piece of legislation to the House. There's a lot of work on HHR. I believe now they're in the inform and advice stage. They do have priority areas that they're working on. Looking at my notes, labor mobility, foreign accreditation, the Center of Excellence on Health Workforce Data, Workforce Retention, Training, Education. So I suspect there's some stakeholders on this call that are engaged and involved in that, and that work is ongoing. Oh, apologies everybody for that. And then on the last three, we talked about health data considerably on this call already. Two other mentions I'd make, and a lot of this is around the Standing Committee of Health. There is lots of work happening there. There are private members' bills that are happening that will be a focus, I believe, in the Senate. There's a bill to have mandatory labeling for alcohol products, I believe. There is marketing to kids in the House of Commons right now. And PMPRB is still a topic that's alive as HESA picks up that study to take a look at what has happened and transpired at the PMPRB over the last couple of years, with a bit of a focus on whether or not anything untoward happened with the recent resignations of the chair of the board, of the executive director, of other individuals. So there will be lots of political drama around the PMPRB at HESA if you want to tune in and get your popcorn. Other than that, I think we are at time. The final thoughts I think we'd land on for here is that, well, this is a very big health financial budget. This is not necessarily the policy budget. This is the down payment to do the policy. And the policy can't be done in isolation with the federal government. A lot of it is on the provinces and territories. So thanks, Marcel, for really walking us through that. And then James really highlighted a lot of the individual policies that different provinces are likely to want to work on. These bilateral agreements really will be the be all and end all in terms of how this funding will be spent. There is opportunity to influence it. You are likely engaged with the provincial governments as well too. And there is a long road ahead in order to land them, but that won't stop funding from flowing already. And that, of course, doesn't stop the Canada Health Transfer as well, which is already increased based on this budget. And last but not least, the Liberal NDP deal is the focus, because that's keeping the government in power, and they clearly will spend a significant amount of dollars to stay in power. So dental care will continue to flow and roll out and expand to more eligible communities. And I would suspect that at one point, the government will want to go on a bit of a tour once they can show that they're getting some impact for dental care so that they get the credit, not the NDP. Anything else, Marcel, Danielle, and James?
I would only add that I think the dental care commitment is a real game changer. And, you know, I used to think that the feds were very careful not to get too deep into provincial jurisdiction. And, you know, the dogma has been, you know, collaborative agreements, no unilateralism. So this is very different. This is more like unilateralism, and it'll be really interesting to see whether it survives the test of the Federation, and if so, what that means for other areas of health policy in Canada.
Thanks, Marcel. Thanks, Danielle. Thanks, James. Thanks all for joining us. Hope you enjoyed your lunch, got to eat something. Now we'll go back to the afternoon. Appreciate it all.
Bye, everyone.